start, right, Janet?
Right.
I think we have our quorum.
Sounds good. So on behalf of Access to Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health, welcome to A Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The GW Office of Integrative Medicine and Health promotes integrative medicine by providing learning opportunities to health professionals and healthcare consumers. Today's wonderful facilitators are Dr. Misha Kogan, who hardly needs any introduction, but he's the founder and executive director of AIM Health Institute and the medical director of GW Center for Integrative Medicine, and Luanne Jacobs, who is a Reiki Master Teacher, biofeedback instructor, and a member of the AIM Advisory Board. So with that, I will hand it over to you, Dr. Kogan.
Okay. Hi, everybody. I'm thrilled to have Luann with us today. Every time she's here, my day is a little different, just because of her presence. And don't think that Luann is all about mindfulness. Luann is at the point in her life where she pulls ideas out of the unified field, and I internally grateful for her. She recently realized her husband and I are writing a book. It's called Optimal Aging. It's actually Andrew Weil asked me to write the book because he's no longer interested in, I guess, I don't know. I'm not going to speak to that. But he basically said, look, I'm not going to write the updated version. His last Optimal Aging book was 2010, I think. So he didn't want to rewrite because obviously it needs to be updated. So he said, look, you got to write this. So I approached Len, and Len said yes. And then Luann a couple of weeks ago had this grand idea. I wish we'd have this idea a year ago. We have 13 age-wise principles, and there so happen to be 13 chapters in this book. We should have actually just took each principle for one chapter. And so that, Luann, the next book that Luann and I is going to write is going to be all about that. Anyway, so, and yes, happy Mother's Day, everybody. Okay, so today, 3 quick updates and then questions, since we've had marvelous talks over the last few weeks. Last week was a super highlight for me. I always feel like I have some tensions, and ergonomics to me is so important. And just to give everybody a heads up, Niall agreed to come back. So we'll have her back. Well, Sage, we already know, but Niall, we're very happy that she'll be back. So first, if anybody remembers, we talked about the CDC update about if you're vaccinated and in your small group of people who are vaccinated no longer need to wear masks. And they specifically said about that to being indoors. Now, if you're outdoors, you probably should stop wearing mask, period, unless you're in some very unusual, extremely crowded situation, like maybe some mass rally or something like this. I'd probably still wear the mask. Other than that, not really. So those are the big CDC updates from that, but that's from last week already. And then there are 2 other issues. So new variants, and I see that one of the 2 questions that were posted already touched up on that. And then the third one, I wanted to talk about one specific issue as it relates to some of the post-COVID topics. So we'll see if I have time to get to that last point. If I don't, in fact, I think what I'll do is with that, I'll just put that aside, and as the questions come up, we'll see if we have time for that. If not, we'll just stay with the questions. I think it's more important. So I don't have more updates on what CDC said, is what I just said. My just kind of take on this is basically, if you know everybody in the room where you are, and you know that all of the people either had illness, now recovered recently, or they've been vaccinated, I think it's pretty safe to take the masks off, number one. Now, of course, the trick is, how do you know that if everybody's vaccinated? And, if you vaccinated, remember, you probably protected. You worried more about them, not yourself, because you could be still a carrier even if you vaccinated. Although the thinking now is that if you are a carrier as being vaccinated, you're going to carry very little. So it's probably you pretty safe to other people. Okay. The second topic about new variants. So the key big new variants everybody heard about, the only real update is the Indian variant, which is supposedly more virulent. The most important point, there's been a study published last week in New England Journal of Medicine saying that all of these variants, all vaccines are still highly protective against. What it means is they're not as effective. And so it means that you actually can get sick. In fact, in our own campus at GW, we just had a faculty who contracted probably Indian variant from a relative and had a very mild illness. So she of course been vaccinated months ago. So it's there. However, the severe illness seems to be almost non-existent. So it's more than 97% efficacious, all existing vaccines against hospitalizations and severe illnesses, including all the new variants. It's just that you're much more likely to get mild disease. That's what it means. But it's still not high percent. So I think J&J was somewhere in the 60% effective, and then both Moderna and Johnson & Johnson is in high 70s, low 80s. So it's still a reasonable protection against any illness. And it's very highly protective against severe illness that requires hospitalization or death. So that's a very good news. So we don't have concerns as of today to say that the current variant's going to mutate quickly so that we will have to get some new vaccines. We don't think that that's going to happen in any near future. Of course, with time, the vaccines may simply become obsolete and they will have to be repeated, because as virus continuously mutates, it's going to start acquiring more and more new variants. Eventually, vaccines are going to stop being effective. The question is, what is that time frame? I'm estimating it's probably more in line with many months. So I think for time being, we're probably okay. So, and I think that was one of the questions. So like this question, happy Friday. My question for today is about whether we know how well the vaccine used in the US responds to the, yes, so we know that I just gave an answer. It's highly protective against the Indian variant. I don't remember the actual Indian variant. If somebody wants to type it up in the chat box, that'll be nice. I do want to, with that, actually, literally, or maybe Luann, when you take over, let's do a minute of silence for India, because it's not just devastating. It's we always think that our government is bad. There are always worse ones. That's basically the bottom line, because this was all preventable, and what they did was completely, But anyway, as you say, as we said before, we're not here to judge anything. We're not a political organization. We're not going to speak to that, but it just feels from, and I do have some friends there, and I heard first line stories that are just beyond scary as to what is happening. Okay, so, and then the second question, and with that, I'm just shifting to questions, and then we'll see where we end up in the 5-10 minutes. So is it true if one does not experience fever or chills or headaches from Moderna vaccine, one's immune system is not fully produced? Completely wrong. I don't know where this came from. That's completely inappropriate statement. It's completely wrong. There's zero data to say that you have to have a fever, chills, or any symptoms to develop a complete, strong immune protection. So no, absolutely no need to worry about that. Nor, by the way, does it mean if you had a strong reaction that somehow you're more protected than somebody else. That doesn't mean anything. It simply means that, yeah, there is an immune response, but you don't actually know what that immune response at the end of the day does. Whether it's positive or not so positive, whether that high-grade fever, chills, and rash and all those things are of any benefit, I probably say absolutely not. I would say that that's actually a measure of a hyperimmune response, which is not necessarily a good thing, but it has nothing to do with whether or not you're going to develop the protective mechanism. Unfortunately, there's not a lot of data as to say, is there a way to screen somebody to know if they're at the risk of not developing strong immune response? The only way to predict this is to know someone's healthcare status. So if somebody is very frail, they have some kind of a immune modifying condition, let's say cancer, or if they're getting medication that suppress the immune system, you could probably assume that their immune response is not going to be as great. Having said that, it doesn't mean that those patients should not be vaccinated. And in fact, it's most likely that they're still going to get significant benefit, maybe just not as much benefit as somebody else, but it could be just enough to render them being relatively protected. Whoever asked that question, I don't know if it was Kate or if Kate asked the other question, feel free to unmute and follow up on that if I'm not answering what you wanted to hear. But I took a pretty strong stance on this because this comes up all the time. I heard this from several other people claiming that, well, I didn't have any symptoms, so am I not protected? That's completely wrong.
Sure, thanks, Dr. Kogan. This is Kate. I unfortunately just got back, so I logged in late, so I'm not sure what you might have said, and just in terms of some of these variants, like the variant.
Okay. So Kate, your question was about variants. Yeah. So I already said that the New England Journal of Medicine published an article last week on this, basically saying all current vaccines are quite protective against the Indian variant. And moreover, it's extremely protective against severe illness requiring hospitalization. It's not as protective for milder versions, but it's protective enough. So there's some good news. And that was my actual whole point, to talk about the variants based on your question, but also based on this article that I just reviewed, to say that for time being, we are okay. So whatever vaccine you got, chances are it's going to last us for longer. And the key question that I can answer with certainty is, how long will that longer be? Will it be a couple of months, or will it be more closer to a year? You remember, the studies have only looked into 6 months of the post-vaccination time frame. Does that mean that the vaccines stop working after that? No, of course not. It just means that they only looked at 6 months, and they said at 6 months, there is still something like close to 90% of efficacy. Of course, with time, the efficacy going to gradually decline. The question is, where is the line of I'm sufficient protective versus no, I'm not sufficiently protective anymore? Only time will show that. And I'm actually more optimistic there than some. I have a feeling that the vaccine is going to last longer than some people may be claiming. So, okay, let's see if there's, I stopped checking the questions, so I'm going to go and see if there are questions. Jennifer, I mean, people going to give you all kinds of looks with or without the mask. It's just, you know, you're going to be in areas where nobody wearing masks, and you put the mask on and they're going to look weird at you. So I think we have to get used to it. We have to just sort of flow with this. And I also would comment to say, don't overreact to other people. I mean, if you feel like they're not following what they should be following, I used to sort of try to educate people, and I just stopped. I realized if somebody's not asking me questions, it's not my place. You know, you can decide it for yourself, but generally speaking, you don't know the people's circumstances, and I think we can educate each other. We can advocate within circles of our friends, relatives, and people we know. But beyond that, I'm not sure that. I mean, within the professional domain, I try to speak up about this, but on the street, it's a little different. And I hear you, but I also want to caution to say, just, you know, don't respond very strongly to people who feel like, you know, whatever, if they're not appropriately guided, it's not our fault. Yeah, okay, so Dana pointing out, CDC distinguished between vaccinated and unvaccinated outdoors. Yes, that's exactly right. Again, the point there is that if you're vaccinated, somebody else is not vaccinated, you're putting the unvaccinated person at the theoretical risk. That's what I was trying to point out to. And the question is like, what would you do? Well, you have to make some decisions. Let's say that you're in a, let me give you a common scenario right now, because it's very useful. So in my own circle with middle-aged parents like myself and Joanne Divaris, who's right there with us. Hi, Joanne. So like we have kids about roughly same age. So we may be, adults may be vaccinated, but kids may not be. So if we hang out, this is the moment where I would say I'm okay not wearing the masks for everybody, because I consider kids at the very low risk. So even though they're not vaccinated, even if I somehow, by some really unusual chance, pass the virus to them, they're at the very low risk. Now, let me put it in another situation. You're with a group of your peers and with the parents. Now, that's when I would mask probably everybody, because I wouldn't want the parents to get any chance if they're, but they obviously should be by now vaccinated. If they're not, there is maybe a problem there. So again, I'm talking about my own family too. Believe it or not, even my own family, it's not so easy. I
Dr.
think that
Kogan?
sometimes you can convince somebody to get vaccinated, not always. Yes.
So I wasn't able to complete my vaccination because I had an anaphylactic reaction to the first Pfizer. So I'm in the unvaccinated category right
Well,
now.
so you got one shot, right?
Right.
So you're 60% chance of protected with Pfizer. You know, you may want to consider doing the Johnson & Johnson, but that's more of an individual decision and probably needs to be at this point heavily guided by your physician. But that's
No,
what.
I agree. I was just pointing out there's some of us that are not fully vaccinated, and it's not by
Sure.
choice.
Right. No, I hear you. And that's when you need, if that's the case, then if you are vaccinated, but somebody is not, you have to make a decision. What is the risk of that person who's not vaccinated? Are they high risk, low risk, or what? If they're high risk, everybody should be masked. That's basically the kind of, yeah. Okay. All right, let's moving on. Why not to continue masking? Great point. Yes, so if you feel comfortable wearing mask, wear it. That's basically, there's nothing wrong with wearing a mask wherever you go. I tend to try to wear a mask if it's not extremely inconvenient outside. When I ran, I have a hard time wearing a mask. If I walk, I wear the mask. If I'm in the car and I'm driving and no one near, of course, I'm not gonna, if I'm alone, I'm not gonna wear a mask, but I may have a mask on right there. So when I step out, I'll put the mask on. I feel like exactly the point. If it's easy for you to wear a mask, what are you losing from wearing a mask? Nothing really, right? So, and as Jennifer said, and then nobody's going to give you looks unless you're in a territory where nobody's wearing a mask, and then they'll give you a look for that. So go figure. Benita, thanks. It's B1617. That's the Indian variant. That's it's believed that most of the current cases of infection in India are this specific strain. Yeah, and Benita, thanks for putting us in. So I think right before Luann starts in a couple of minutes, we should take a minute of silence and sort of.
Thank you all. It's quite shocking to hear like your own family members are actually in that situation. We just found out yesterday.
Yeah. Yeah. So Irene's asking a good question. Is the surge and spread of variants coming from less developed countries, or are variants posing up and posing up in the economically more delayed country societies? I don't think so. I think the variance is simply a matter of timing. I don't think that they necessarily related to which parts of the world. I think it's sporadic. So let me give maybe a minute or two of a kind of a baseline, because I don't know if everybody fully understands this. It's reasonable. So, you know, the viruses that mutate a lot, you usually have mutation that's negative, meaning the mutation will be it's a random process. So what happens is it actually deselects the virus. So in essence, virus becomes less efficacious and it dies faster. But then, of course, there are occasional positive or beneficial mutations for the virus. Those are the viruses that are going to get selected, and then they start multiplying faster, gradually dismissing the larger pool or the other pool of the viruses. And the good news is that the majority of mutations are either neutral or they're just negative. They're actually worse. So that's why it takes a lot of time for the virus not only to mutate, but also to mutate so positively enough to start being the kind of a predominant in a given population. I don't think that what happens in India is just based on this strain, based on this mutation. I think it's just, from what it appears, it's a very inappropriate handling of the pandemic. They were lucky in the beginning, and then they said, oh, we good, we fine, and then this happened. Plus, the variant, of course, played a little bit of a role, but I don't think it's the most important role. So I think we're going to keep seeing sporadic mutations popping up in different places. I don't think we're going to be able to predict where they're going to appear. I think the main prediction would be they're going to appear in the places where there's a largest amount of infection ongoing, because it's all statistics, right? So the more chances for virus to spread around, the more likely more mutations going to occur, and eventually one or whatever number of infections is going to be creating to be more positively selected, because the virus is going to get more infectious or more virulent or whatnot. So, okay, I'll see if there are other questions. Yes, I did not follow Novavax vaccine. I guess homework for Dr. Kogan for I don't think I'm speaking next Friday because I'm presenting at another conference, so it'll probably be the week after. Maybe less risk of developing autoimmune sequelae. I don't know. So Lauren, thanks for questions. I can't answer everything. Stay tuned. How long are the vaccines projected to last? I kind of tried to answer this already. Christy, if you want to unmute and see if I answered it already. I think that they're going to last probably longer than we think. I mean, I think a year is a reasonable number to put on there for now, although I think the kind of more conservative number is 6 months at the moment, but I have a feeling it'll be better than that. Okay, large button from Amazon. Got the vaccine. Okay.
I got that button in Amazon, and I wear it when I'm not wearing a mask, so I don't get dirty looks.
That's actually, well, yeah, they can live with that, with the dirty looks, but that's actually very useful, because when you wearing that sign, that people know that you're vaccinated, right? So they're gonna, the only question to this is, if half of us start doing this, does that mean that the ones who would not wear is not vaccinated? You know what I'm saying? So we have to be a little careful. If it becomes a trend, I think it could be really important. But of course, if it does become a trend, then people who don't like to wear it. So I don't know. I'm not sure what I think about it in the long run, but it's definitely not a bad idea in a certain,
I did it to not get the dirty look, but it's right. It can be worn by people who aren't vaccinated. It's not a sure thing.
Janet, where'd you get this statement? Breaking news. Last I've seen, the idea was that it's most likely the case.
It came, let me see. CDC.
By Praxin. Well, that solves, I mean, it sounds like CDC was cooking up this statement for past couple of weeks, because first they said stop wearing masks in the groups where everybody's vaccinated indoors, not just outdoors. But if that is the case, then let's say group of people where one person is unvaccinated, everybody's vaccinated. So now suddenly that person has a herd immunity, right? In essence, because not going to pick it up if this statement is correct. It definitely has been the case in Israel, where they published studies showing that the risk of infection from vaccinated person to unvaccinated is exceedingly low, and nobody had a severe illness in such scenario. So it makes sense, but I did not see studies like this in US, so maybe they are done. Good. It's another homework for in 2 weeks for me. All right, I'm gonna scroll down and because we're running out of time. I'm reading Paula's comment. Exposure to the pseudovirus resulting in damage to the lungs and arteries of an animal rodent, showing that the spike protein alone can cause damage. Doesn't the COVID injection code? Yeah, I have a hard time understanding this. You can't really give a spike protein and expect any problems because it doesn't have any capacity for anything, right? Because the protein itself, even if you're injecting, it's going to have very short half-life. Just FYI, proteins get disassembled in seconds. Well, okay, minutes. So there's no chance they can cause any damage. I'm not sure. Paula, if you want me to look at this, you're going to have to send me the study, but the conclusion cannot be the way it's typed at the moment because it doesn't make any biological sense. The same goes, by the way, for the vaccines. When you administer mRNA, what happens is that piece of mRNA, its life is exceedingly short. But in that short period of time, some of that RNA becomes a protein. So you have a couple hours of expression that is enough to start generating antibodies, but there's no chance of that causing long-term damage in a sense from the protein itself because it's not in the system for more than a few hours. So there's not enough length to, maybe rodents you can cause damage on a rapid scale because they're much faster metabolic models. I don't know. I'd need to look at the study to make a heads and tails of it. So. All right, CDC guidance is given unvaccinated people carte blanche to not wear masks. There's no way to tell when outdoors who is vaccinated, who is not. Interact with others at your own risk. Benita, thank you. Golden words. Everybody should copy paste it on their refrigerators. I'm not exaggerating. It's exactly right statement. Are there any more treatments available for COVID persons taking precautions for following boosting? Couldn't that be? Okay, great question. Great point, Linda. The problem with that is that while we have some much better treatments now, and the antibodies, monoclonal or polyclonal, so multiple, whether it's Regeneron or others, do have efficacy. So we definitely have steroids. We have some treatments. The problem is this: even the very mild COVID that doesn't land people in the hospital, you still have 5 to 10% of long-term severe complications. So the problem here is not just that we can treat effectively. What we can't yet treat effectively is post-COVID. And unfortunately, even in the very mild cases, they're in adults. We're not talking about children. Children don't seem to develop post-COVID sequelae from the way I read the literature. But adults, and the older they get, the more likely they develop the post-COVID sequelae and more severe, although it's not all depends on the age. So that's the problem. You just don't want to get sick at all if you can avoid it. Okay, I got to stop, right? We're at 2:30. Let me just run through the questions real quick, and if there's anything really critical. Joanne, no, that doesn't mean anything.
No.
Should one wear a mask around newborns? Great question. I don't know how to answer this. I don't have the answer to the newborn question. So I'm sorry.
Talking about whether you have a
Somebody is not muted.
You have a headphone? No, I'll turn it off.
How do we deal with usual flu vaccine and COVID vaccine? All right, guys, I'm going to take that question for one of the next topics. It's a really good question. We misaddressed it this year. Nobody had flu this year. Very few people. I'll explain to you how I think about this next time. Well, thank you, everybody. With that, I'll hand it over to my favorite grandmother. I think I can say that, right? Is that okay?
Yes.
Okay.
Oh, yeah. I have a lot of grand dogs. No grandchildren, but a lot of grand dogs. Misha, you wanted to take a minute of silence for India. And actually, at the end of the meditation today, there's a perfect spot for us to continue that. So let's just take a few moments right now to bring into our hearts all the people who are really suffering around the world. And that one of the things that we can do here as a group is to use our group energy to send out healing thoughts, healing intentions, and of course, healing love to any and everyone who is in need, just as an offering. It always helps. And at the end, we'll do a little bit longer piece on this. Today, we're going to do what I call a chakra scan and an energy recharge. And I'm sending out some thanks to Marcia Miller from Yoga on High in Columbus, Ohio. I heard this meditation from her a couple of weeks ago, and she graciously allowed me to copy it and use it here today with you all. Marcia was one of my first Reiki students who became a Reiki master back in the 2000s, early 2000s, and she since brought a whole Reiki training school, not only to her yoga school, but also to the Urban Zen Institute therapy practices in Ohio. A couple of weeks back, I read an article entitled, "The Name of the Blah You Are Feeling is Languishing," and it may be the dominant emotion for 2021. The New York Times article by Adam Grant captured my interest because it described perfectly what I had been feeling since the euphoria of getting vaccinated had subsided. What now? Where was that feeling of freedom that I expected to come by getting vaccinated? Last year was so much about intense fear and grief, but that has moved somewhat to the background with the rollout of the vaccinations. And in place of it, not just, okay, we are free to do whatever we want. It's not that yet. There are still a lot of unknowns, and we have not really gotten a handle on the virus yet and how it has changed our lives for good. But what we have learned this past year is that no matter what we are feeling or what is happening, we can come here to this group, and for an hour, we can ask questions and get some thoughtful, fact-based responses, not always answers, but fact-based responses. And we can share in supportive and creative practices that bring us into balance and support us. And the gifts from many practitioners who come here and volunteer their time, they also come because they need to be together and receive your support. I am also reminded of another factor about the power of community, and that is taking refuge in our interdependence. It's not a weakness to be interdependent. It's a principle of flourishing. And flourishing is the opposite of languishing. It is the middle of spring, and I am reminded of the interdependence and the rule of reciprocity in the plant kingdom. In the indigenous garden, we plant 3 seeds together that support each other. They're called the 3 sisters: corn, beans, and squash. Planted at the same time, corn emerges first and shoots up to provide a structure for the bean that comes next and twines around its stalk for support, while feeding the soil beneath with nitrogen. Squash then spreads out close to the ground, preserving moisture and shading the corn and beet roots. Which leads us to today's meditation. How can we flourish once again? So we begin, as we always do, by finding a comfortable place, either upright, as I am, or reclined, whatever you prefer. And if you are upright, try not to be rigid in your uprightness. Don't use your muscles and create tension, but find a comfortable way and allow the energy of the meditation to support you. We're going to practice remembering how to call in the universal life energy force for the purpose of recharging our depleted selves. Think of it as we're going into the garden of ourselves and we are co-creating with the life force. Life energy is magical. and present all around us and in us. And once we recognize that, well, then we can call on it when needed. Today is a practice of connecting to the universal life energy. And we practice not in order to make things perfect, but to realize things are already perfect, perfectly what they are. And that's a quote from John Kabat-Zinn. So, settling however you wish, we breathe in 3 times into the present moment. Being here together into the now. And then we breathe in 3 times into our bodies to connect, to sense what's happening there. And then 3 times into our intention to connect and receive life energy. And then turn your attention to the top of your head and start to notice what is there. Our chakra scan and energy recharge parallels many of the body scans we have done in the past. In body scans, we can do a top down or a bottom up, or we can jump all around the body in order to distract the mind. But today we'll do a top down flow. Maybe you see the chart behind me. And in many graphic charts, it appears that these energy centers are fixed, but in reality, they can move around, be different from day to day. So do your best to just tune into, be curious, and explore rather than try to match some picture you might have of where the centers are. For most of us, sometime during or at the end of the day, you will take your cell phone and you will plug it in to recharge the battery. And so we have a smaller vessel that you are plugging into a bigger energy source in the electrical system of your house, which is then connected to a whole bigger energy grid. And so this practice is going to be a little bit like that. You're going to have an intention to plug yourself in to a vaster energy template of the universe. And so feel into what hearing that phrase feels like in your whole body. And then bringing your attention to the crown, to the top of your head, also called the Crown Chakra or the Crown Energy Center. Notice what you may sense at the top of your head. Maybe your hair, or just a feeling of air there. Or even a questioning of where at the top of my head is the right place. Is it slightly forward, where the soft and receptive place was when you were born into the world, the fontanelle? Or is it slightly back in the head? Let your attention linger here on any physical sensations around the head. And it might even suggest that there is a skylight up there, and you are opening it up or sliding it open to let in this loving universal energy come pouring in, but just to the degree that it feels comfortable to you. You're in charge of this. You're in charge of how much comes in and how fast it comes in. And you are already a part of this energy template. This is nothing different than what your body-mind system already owns and is already present. It's a reconnection or a recharging to a knowing you have had before. So each of us will have our own unique experience of what is felt in each center we are tending today. You might feel pulsations. You might feel light coming in or experience a kind of glow or radiance. You might have a sensation as you breathe in and exhale that you are breathing in and exhaling out the top of your head. Out the top of the head with a sense of knowing that you are energizing each energy center like its own special mini battery. You've got the big universal battery, and each of the chakras are mini batteries serving your system. There is a way in which that crown chakra center might open you up to the energy center then in your forehead. It might feel that there is a light shining down, and as the energy comes in, it starts to pulse through the energy centers below, first into the forehead. These chakras are not fixed locations, as I've said, so just feel inside and have your own experience of where is there an energy center here? Where does it feel like something is happening? For some, the brow center can be right behind the eyes, or the center of the head, or the center of the eyebrows. For many of us, it changes day to day. It may not be the same all the time. So as you inhale through the crown, bring the energy down now into the center of your head, somehow, somewhere. And then can you rest inside this space so that you are not looking at it from the outside, but you are actually in it? Sometimes people see colors or hear sounds or notice smell or fragrance, or don't notice much of anything, but just kind of a quietness or a peacefulness. Just continue to focus on your own experience, whatever that might be. And now this center opens up to the next one, inside the mouth. Feel along the roof of the mouth as you inhale through the crown. Let the light, let the energy be drawn down into the resonant roof of the mouth. The jaw softens. And feel whatever it is here for you to feel. Then the mouth chakra, the light here opens into the throat. So as you inhale from the skylight at the top of your head, that inhalation draws it in all the way to your throat next. As the energy comes in, it stabilizes and then maybe even expands a little as you exhale. So the energy now is accumulating. It doesn't go out, it stays in. As you inhale into the throat, to the degree it's comfortable for you, keep remembering you control the amount of energy and the rate that it flows in. As you inhale, it stabilizes. And as you exhale, it expands in all directions, becoming a three-dimensional energy center Now throat opens down into the heart. And as we move into this area, it may be easy to put one or both hands here at the heart and stay really restful as you inhale and feel the energy being drawn in to support the heart center. Inhale the energy in, exhale and stabilize, absorb and expand, not just in the front, but in the center of your body, glowing forward, backward, and upward, each chakra supporting all the others in all directions. Sometimes when we linger in the center, we feel emotions or stories or memories that want to be integrated. And again, to the degree that it is okay with you, for you now, in this moment, or not, you can let it be. Trusting that this universal energy will support and care for whatever is here. And the light at the heart center glows downward. And sometimes maybe it's even pulsations that you can feel, that the resonance now is a little bit lower in the upper belly or at your navel. Maybe feel around in the belly and see what you notice and where you feel a sense of resonance. You can leave a hand on your heart and another on your belly, or both hands to the belly. Experiment with what would work for you here, right now. Every inhalation is through the crown, down into the belly. Exhaling, the belly energy stabilizes. Perhaps expands in all directions, vibrant, glowing, radiant, pulsing. Perhaps leave one hand here wherever you found something interesting, and place the other one in your low belly, feeling whatever is here. As you inhale through the crown and all the way down to the belly, drawing in not only the breath, but the energy of the breath into the deep belly center. And here, perhaps it vibrates, or perhaps it shines, shines, shines. And this center helps to illuminate the one below it at the base of your torso, in front of the tailbone. This is the base of the central channel that flows then back up through all the chakras. But linger here at the base for a few moments as you inhale from the crown and pull it all the way down to the base of your torso. And from this place, it's really the center of the center. You can perhaps feel the central channel going up through all the chakra centers you've visited on the way from the top down. How they are aligned on the central channel from the base all the way to the top. Energy flowing down as we have been doing so far, but it can also flow back up. Let it be happening in any way that feels appropriate to you. Any speed. And you may, as you let your attention be drawn into the center of the center a little more, you may feel as you are going up or down, there is a kind of pulsation like you are ringing a bell at each of these centers. You can feel the flow up or down. And maybe there's an extra light here pulsing. And in addition to the central channel and the chakras, there's thousands, so-called 72,000 nadis, or subtle nerve endings, subtle nerve pathways moving through the body, starting at the receptor centers, those chakras, and extending out through the whole body. The whole body is filled with these channels, lit up like tiny lights on a Christmas tree, lit up like the radiant sun. And from the heart, for example, the nadis radiate through the shoulders, the armpits, the upper arms, the elbows, the forearms, the wrists, the hands, the fingers, each one shining and radiating and pulsing light from the fingertips and pouring out through the palms. Let yourself feel yourself for just another moment or two, this glowing and radiant, pulsing, energetic being. On the energetic level, this is happening. This is a template, and you can feed this energy through the physical body as well. So have a moment now where what's under the surface now melds with your skin, your bones, your muscles, and all are nourished by the subtle energy template that is all alive and pulsing within the physical form. And now, if we will, we could take this moment and find if there's a place calling out to you for you to put your hands on, or if there is a felt sense that you have enough and you can now give some of this away. That maybe with one hand on and one hand with the palm facing outward, we can reciprocate and we can send out to this group or to those in India or elsewhere who are suffering, or just back out to the universe. Any way that you feel inspired to share in this moment, let it happen. When you're ready, you can return to your physical room. Return with a deeper breath into your bodies. And when starting to move, wiggling fingers and toes, deepening the breath, opening your eyes, and carry this recharged energy into the rest of your day. Thank you so much.
Thank you so much, Luann. That was fantastic. I'm wondering if anyone has any questions.
Thank you, Luann. I think everybody have a great weekend. And as I said, I will not be, actually, I will be joining a little bit of next week, but I'll have to leave early because I'm presenting during our 2 to 3 p.m. Good weekend.